Good afternoon, everybody, and good morning to those who may be a little farther west than we are here on the East Coast. I'd like to welcome you to today's online presentation where we will be discussing the new health benefit marketplace, exchanges and beyond. So let me go ahead and introduce our presenters today. We've got Richard Johnson presenting. He's our Senior Vice President and Public Sector Health Practice Leader with the Siegel Company.
Good afternoon, everyone, and good morning.
In addition, we have Kathy Bakich. She's a Senior Vice President and Health Compliance Leader with the organization.
Thanks, Chris. Hello, everybody.
And I'm going to turn over today's presentation to Howard Goldsmith. He's going to get things going. He's a Senior Vice President and consults on these issues in the public sector marketplace.
Thank you, Chris, and welcome, everybody. Most of you have probably been bombarded enough with plenty of material on the Patient Protection Act and the Affordable Care Act, or together what we fondly refer to as healthcare reform. Most of the material up until now has probably been focused on what group health plans and sponsors have had to do in order to maintain compliance. So plans have focused on things like offering essential benefit coverage of dependents until age 26 or age 29, removal of plan limits, things of those sort. The next part of healthcare reform, however, and what today's presentation is going to highlight, I'm going to really refer to as universal access. And this is really referring to how healthcare reform is intended to provide coverage through the exchanges to those that do not have insurance, starting first with individuals and those at small businesses. So many of you now on the call might be thinking, well, what does that have to do with me since we already sponsor or participate in a group health plan? Well, to you folks, I say just indulge us as we highlight the different connections that we're going to make between the individual access and group-sponsored plans and make the links to how that may affect our public sector constituents. Now, as we go through this, some of the material, it is complicated. There's a lot of different people on this call with various levels of understanding. We have administrators, plan sponsors, employers, labor groups, and some health plans. So we're going to try to go through the material in a simple way that will help to make these relationships clear to you. Okay? What we're going to cover in this presentation, of course, will advise you of the information that you should know. We'll also be able to advise you of some of the actions that you might want to consider taking now. And finally, this is still very much a work in progress, healthcare reform, so things are still changing. There still will be further guidance. We'll point those out as well.